Hello and welcome to our channel. Today, we're discussing a respiratory condition known as byssinosis, often referred to as brown lung disease. This condition is primarily associated with occupational exposure to cotton dust and is especially prevalent among workers in the textile industry. Byssinosis is classified as a type of pneumoconiosis, a category of lung diseases caused by the inhalation of certain types of dust. The name, byssinosis, comes from the Greek word, byssinose, meaning, of fine linen, reflecting its association with plant fibers, specifically cotton. When we breathe in cotton dust, our lungs react to the inhaled particles. This can trigger a number of symptoms, usually more pronounced on the first day of the workweek, following a period of rest. This phenomenon is often referred to as Monday fever, and it may include shortness of breath, chest tightness, and coughing. The underlying process is quite complex. When cotton fibers are inhaled, they can cause inflammation in the airways of the lungs. This chronic irritation can lead to progressive damage over time. In the early stages, symptoms may be mild and often mistaken for seasonal allergies or common colds. However, as exposure continues, the symptoms can worsen, leading to more severe respiratory issues, including chronic bronchitis and potentially even irreversible damage to lung tissue. It's important to acknowledge that byssinosis is not only a concern for those currently working in textile mills but also for those who may have worked in these environments in the past. The risks are particularly high in locations where protective regulations and controls are minimal, leading to significant dust accumulation in the air. The diagnosis of byssinosis is primarily clinical, meaning that doctors rely on the patient's history, symptoms, and occupational exposure to cotton dust. Pulmonary function tests may be conducted to assess lung capacity and function, while chest X-rays can help rule out other conditions. In some cases, a biopsy or more advanced imaging may be necessary to confirm the diagnosis and assess the extent of lung damage. Preventing byssinosis largely hinges on workplace safety practices. Implementing and adhering to strict ventilation systems can significantly reduce dust levels in the air, along with the use of personal protective equipment like masks. Regular health screenings can also be beneficial in monitoring lung health for employees at risk. Sadly, if the condition progresses to a severe stage, treatment options are limited. Management of byssinosis generally focuses on alleviating symptoms. A physician may prescribe bronchodilators to help open the airways and inhaled corticosteroids to reduce inflammation. In extreme cases, supplemental oxygen may be necessary to aid breathing. Public health initiatives seeking to raise awareness about occupational hazards in industries like textile production are crucial. Workers should be educated about the risks associated with exposure to cotton dust and empowered with knowledge on proper safety practices. Staying informed through educational programs and utilizing workplace rights can help protect individuals in high-risk environments. It's important to remember that byssinosis, while serious, is preventable. By advocating for safer working conditions and prioritizing the health of workers, we can help eliminate this condition. Thank you for joining us today to learn about byssinosis. If you found this information useful, please like this video and subscribe to our channel for more educational content on health-related topics. Remember, taking care of your lungs is essential for overall health, so stay safe and informed.